Welcome to the PTCB Exam Ready Master Guide on Pain Medications. We will cover opioids, controlled substance schedules, safety, side effects, and essential exam traps to ensure your success. This master guide covers 5 key areas, starting with opioid analgesics and moving through non-opioids, nasal and oral formulations, safety, and clinical considerations. Our focus is on the most testable drugs for the PTCB exam. Chapter 1 focuses on opioid analgesics, which are the most testable pain drugs on the PTCB exam. We will cover injectable, oral, and nasal formulations. Injectable opioids include morphine and hydromorphone, both Schedule II controlled substances. Morphine's brand name MS-Contin is an extended-release oral form. Hydromorphone, or Dilaudid, is much more potent than morphine, used for moderate to severe pain. Fentanyl and methadone are also Schedule II substances. Fentanyl is extremely potent, but the Duragesic patch is for chronic pain only, not acute pain. Methadone has a long half-life and treats both pain and opioid dependence. Moving to oral opioids, hydrocodone and oxycodone are C2 substances. Common hydrocodone combinations include Vicodin and Norco. Oxycodone formulations like OxyContin are extended release and must never be crushed or chewed. Naloxone is the opioid antidote and a non-controlled substance. It works as an opioid receptor antagonist, rapidly reversing respiratory depression. Key brand names are Narcan nasal spray and Evzio autoinjector. Repeat dosing may be necessary. Chapter 2 covers non-opioid analgesics, essential options for pain management, including NSAIDs and acetaminophen. These drugs are typically non-controlled substances. Injectable non-opioids include ketorolac or Toradol, and NSAID for short-term pain, maximum of 5 days. IV acetaminophen or Ofirmev is used for pain and fever, but monitor the total daily dose for liver toxicity, keeping it under 4,000 milligrams. Chapter 3 explores nasal and oral analgesics, focusing on alternative routes and formulations for pain management. Butorphanol nasal spray, brand name Stadol, is a Schedule IV opioid mixed agonist-antagonist, primarily used for migraine pain. For oral analgesics, common NSAIDs like ibuprofen and naproxen and acetaminophen are essential to know. Chapter 4 addresses safety and clinical considerations, covering critical safety protocols, side effects, drug interactions, and pregnancy information for the PTCB exam. Opioid side effects include the dangerous respiratory depression, common constipation, and sedation. NSAIDs pose major risks like GI bleeding and kidney injury. Acetaminophen's primary risk is dose-dependent liver toxicity, with a maximum of 4,000 milligrams daily. Opioids interact dangerously with alcohol and benzodiazepines, increasing respiratory depression and sedation. NSAIDs increase bleeding risk with anticoagulants. Acetaminophen, combined with alcohol, increases the risk of liver toxicity. Opioids are generally Category C or D in pregnancy. NSAIDs are avoided late in pregnancy due to risks to the fetus. Acetaminophen is generally preferred. Remember that local anesthetics like lidocaine and bupivacaine are not opioids. Chapter 5 covers PTCB exam pearls and traps, highlighting super high-yield facts and common mistakes to avoid for exam success. Key exam pearls include knowing that most opioids are Schedule II, with butorphanol being CIV. Remember that naloxone is the antidote. Toradol therapy is limited to a maximum of 5 days. Fentanyl patches are only for chronic pain. Avoid common exam traps. Fentanyl patches are not for acute pain. Hydrocodone combinations are C2, not C3. NSAIDs carry risks of bleeding and kidney injury. Never combine opioids with alcohol. Do not crush extended-release formulations like OxyContin. You now have the essential pain medication knowledge to succeed. Focus on controlled substances, brand generic recognition, and critical safety protocols like naloxone use and the Toradol 5-day limit.